Hey, good afternoon. Since everybody is not available for our weekly lecture, uh, I will try to record this lecture so that everybody can listen, no, and watch. So last week I sent you uh, a written module, no, about research, about what is research all about. Now I'm gonna browse through that topic so that it can be properly explained to you. No? So welcome to Nursing Research 1. As I have stated in our um, lecture module, research is a systematic inquiry, no, that uses scientific methods to answer the question. So when we say a systematic inquiry, it is a step-by-step question or investigation, no, that answers questions and solve problems in our daily life. No? Its ultimate goal is to develop, expand, or refine a body of knowledge. So when we say develop, there is an existing information about the problem, but we need to further the knowledge. No? Same with expanding it. You need to acquire more information. That's why you're conducting a research. Or there is a few details that is left unanswered. No? So we need to refine that knowledge. So basically, nursing research is a systematic inquiry that develop evidences about issues important to the nursing practice. No? Kaya nga nilagyan ng nursing yung research because it primarily involves the nursing practice. No? It can either be the nursing practice, education part, or administration ng nursing personnel. Okay. So when we say clinical nursing research, it means it is the research designed to guide nursing practice and improve health and quality life of patients. So this is applied in the clinical setting. So whatever problems you encountered in the clinical setting, and you wish to make a systematic inquiry or investigation about that problem to answer that problem, that is your clinical nursing research. Okay. Now, evidence-based practice. We always hear this when we discuss nursing research. So this is defined as the use of the best clinical evidences, no, in making patient care decisions. Bakit evidence-based practice ang sinusunod natin when we are applying our nursing interventions? Because it has clinical evidences or uh, proven by investigation that this patient care or those intervention is effective in caring for your patient. So that's why we lean on to the evidence-based practice. Okay, let's say for example, uh, when it comes to infection control, no, the last thing a patient wants when going to hospital for treatment is having acquired no hospital infection. No, the nurse usually play a key role in helping to prevent this illness before it happens. When we say infection control. So when we say evidence-based, so these are infection control policies that have been implemented in the past and have successfully get got rid of the or lowered the hospital acquired infection. Okay, so for example, your hand washing, no, the hand washing technique, it has been already proven to lower the risk or the rate of hospital acquired infection, no. Okay, keeping your environment clean, doing because it has been found out that the the materials or the the things that the patient have around him or around her is or can be uh, uh, something that can transmit or um, be a medium for infection. So doing environmental care is is considered your evidence-based practice, no? What else? Using protective barrier, no? Yung gloving and gouging nyo. It is also effective, no? Shown by evidence-based practice to lower or prevent hospital-acquired infections. So yun. So, even though na it is very tedious for the nurse, no? Kahit busy pa si nurse na marami siyang ginagawa attending to patient, taking time to do this lowers the risk or prevents infection. So, ito yung example na evidence-based practice nyo. Okay. So, now let's go on to the purpose of nursing research. So, these are the purposes of your nursing research: to explore or expand knowledge on issues concerning nursing practice. So, ito nga, there a wide area pa of the nursing practice that needs a lot of information, no? So, this is one of the purpose of your nursing research. Another is to solve problems in the nursing practice through evidence-based result. By doing research, you'll be comparing the cause and effect of an intervention. So whatever produces the best result is your evidence-based practice, no? So that is used to solve your problems in the nursing practice. And then to ensure credibility of nursing profession. So how can a patient um, be confident enough to let you handle his health? No, we follow a scientific based procedure or intervention. That's why it adds up to our credibility. No, so that's why the patient trusts us in handling their healthcare problems. So another, providing accountability for nursing practice. No, so when we say accountability, this is your um, whatever you do in your practice, it is backed up by science. No? So whatever you do, you can you can justify it that it has been the results are based on evidences. So that's what it means when you say provide accountability. No? And also lastly, to document effectiveness of nursing care. So as a healthcare professional, we always aim to lower the cost of hospitalization. So we are always constantly trying to find interventions that are cost effective, since if we are pro patients, no, we are a patient advocate. So being cost effective when it comes to interventions is one of our responsibility. So these are your purpose for your nursing research. Okay. Now there are types of research available in when we say research, no. First we have the type of research according to nature. So when we say nature, dalawa yan. We have your basic and your applied research. So basic research mainly focuses on investigating basic reasons, no, or principle behind an occurrence or phenomena in the nursing care practice, no. It may or may not have an immediate use or application. So pwedeng gusto mo lang malaman kung bakit ito ang nangyayari, Or for example, when you wash your hands, gusto mo lang malaman kung or gusto mo ma-prevent yung infection. So gusto mo malaman kung ano yung makaka-prevent ng infection. It doesn't necessarily mean na you will apply what is needed to remove that infection. So you're just basically providing knowledge, no? So it does not directly address real world problems, no? And its goal is to expand knowledge about a certain issue. And then applied research naman, ito yung the opposite of your basic or theoretical research. It aims to find a solution to pressing problems and issues that you're facing. So, dito, ina-apply mo na yung, so you're doing research to find a solution so you can apply it in your nursing practice. It determines also the possible uses of application. No? So, with that knowledge gained from the research now, you can now use it to its different areas of application. Yeah. So, next, um, for method naman, we have your quantitative and qualitative types of research. So when we say quantitative, that is numerical. It is a systematic investigation of an observable phenomena through use of computational, mathematical, and statistics techniques. So anything in the research that you use that can be measured or aims to measure the scientific data, that is your quantitative research. While qualitative naman, this is investigations of the non-quantifiable phenomena, like life experiences. Like, for example, uh, you want to find out the psychological impact of, let's say, the pandemic, no? That is your qualitative research. So we are more expanding our knowledge about something that cannot be quantified. So like your experience, life experiences. Okay. So the characteristics of qualitative research are non-numerical and is usually descriptive. So whatever, so the results of the investigation usually is being described through words, no, explore and aims to know the meaning, nature, or dynamics. So it is basically knowing what caused it and how it happened. No? So why and how. So that is your qualitative research. Now there is also this type of research that is um, based on design. So this is applicable to your quantitative research, no? So below quantitative research, we have this type of research design. Your experimental, your quasi-experimental, and your non-experimental. So when we say experimental or your true experimental research, no, under to sa ano, sa quantitative, it aims to establish a cause and effect relationship between independent and dependent variables to scientific method. So there is an independent variable and there is an dependent variable. So in in this type of research, there is manipulation in the variables. No? So ibig sabihin, we are doing something to the variable. Then we are doing randomization, no? Later, I will discuss about randomization. And it also has a control group. And whatever result between these, between manipulated variables are measured. So if you do something, do an intervention to something, to that specific variable, may nangyari ba sa result? So we are measuring it through numerical data. So that is your true experimental research. So how about your quasi-experimental? So parehas lang sila, no? Cause and effect relationship aims to explain or establish the cause and effect relationship, but there is no randomization. Instead, the subjects are assigned to groups based on a non-random criteria. Let's say, for example, yung patients nyo, what you are trying to understand the effects of uh, post-surgical pain, post-operation pain in, let's say, elderly. So, your subjects would be all the post operation surgery. Hindi mo siya hindi mo siya masasabi na different categories yung mga subjects mo because wala kang choice eh. So this means that there is no possible randomization in the problem that you wish to answer, no? That is your quasi-experimental. So for non-experimental naman, this is more of a descriptive type of research design. Wala siyang manipulation or control, walang independent variable, walang randomization, wala siyang lahat. It is only conducted when during the study, researcher cannot control or manipulate the subjects. No? You only rely on the interpretation of or observation to conclude. So whatever there is available data, hindi mo siya hindi mo siya makokontrol, hindi mo siya ma-influence. So hindi mo siya pwede bigyan ng intervention to derive a um, certain result. So that is your non-experimental. Okay, let's say, for example, a study to determine the effectiveness of the preoperative pain management intervention for relieving pain among elders undergoing surgery. So remember, no, we are trying. What are we trying to determine here? This is this is the preoperative pain management intervention. No, we are talking about. We would like to know if that pre post-operative pain management can do something about your pain relieving in elderly. Okay. By nature, we are trying to find a solution to the pain that the elderly is experiencing when they go through surgery. So, yeah. If by method, okay, let's categorize this based on the different types of research. So since we are trying to find out or we are trying to find the solution, no, to the problem, we are trying to apply that solution to the problem. That is your applied research, no? And if by method naman, uh, what can you classify this? Okay. Can pain be measured? Yes, diba? So going back to our types of research based on method, we said that any study which is classified as that has statistical or mathematical process, it is classified as your quantitative research. No? Okay. So how about for the research design? Okay, so it depends. If you are using a randomization, then there is a manipulation of the variables. Let's say sabihin natin sige, the independent variable is your preoperative pain management. So you will choose patients who are about to go surgery, and then you assign them, you pick them randomly, no? And then one group you use pre-operative pain management, and then the other wala, the normal pre-ops lang. So you will measure the two kung sino yung who are those who have more or less rather or less pain that experience that is being experienced after the surgery. So you can measure that. So that is your experimental research, no? Okay, so if there is no randomization naman, then it is your quasi-experimental. If non-experimental naman, I mentioned that it is only applicable when a research when done, cannot be controlled or manipulated. So this is considered as your quantitative or your experimental research. No? Okay. So let's go to your building blocks of a study. So what are the different what do you say different types of, let's say, different types of um, mga concepts, no? Concepts that involved in a research study. So let's say, for example, we have here your phenomena. Phenomena is anything that is being researched, or these are ideas, no, that is related to your quest, or something that you are investigating. It can be, for example, it can be pain, coping, grief, no? That is the example of a phenomena. That is what is happening to your patient or in your nursing practice, no? Okay, so in order to describe or explain these ideas surrounding that concept being put under research, ito naman, si theory. A theory is used, no? This is a systematic, abstract explanation of something, of some aspect of reality or a particular concept. So basically, theories are systematic and scientific-based prediction of how a phenomenon will behave or act. Okay? So, or for example, in quantitative research, we pointed out na this type of research is based on the capacity to measure numerical data. So a theory in this type of research aims to generate ideas of a behavior or outcome of a phenomena that can be backed up by a tested empirical or numerical data. So given the example research kanina, we want to know how post-operative pain differs in elderly using a variable that can be manipulated. Yung kanina sinasabi natin pre-operative pain management. So that is your independent variable. To test, no, whether the theory of adding yung intervention na yun will have an effect on the levels of pain of those patients after surgery. So you can say that by stating that there is a significant reduced amount of pain among post-op yung sa patient kanina which undergo a special preoperative intervention. That is an example of your theory. No? The idea of pain that can be altered can already explain an aspect of pain experience. So that is a theory. Now, if the research naman is qualitative, no, qualitative, the opposite of quantitative, a theory may be a result of the research itself. No, it aims to explain a phenomena. For example, pain, using the research data that was collected among the participants of the study. So, ang difference lang between qualitative and quantitative, no, qualitative is descriptive in nature. So, hindi natin ito siya measure by numbers, but we can analyze uh, the results by doing a narrative form. No? So, okay. So, how about variables? Variables are, okay. Variables are elements or feature or factor which is liable to change. No? Kaya sinasabi natin variables, they vary. They can vary. No? Pwede pa iba-iba. So there are a lot of elements or factors that can be distinguished to explain a certain phenomena. So in our human experience, meron tayong areas of reality which we can apply variables. For example, yung weight, yung height, yung age, and yung common denominator of these categories is there is a wide range of data that can be covered. And yun. Then it may be unique to a certain, then it may be unique to certain individual. No? So, pwedeng meron siya, pwedeng sa kanya lang meron. So, that's what it means when we say variables. So, ito yung mga terms and concepts that we need to familiarize ourselves when doing research. No? Okay, so let's go to the different types of variables. No? Meron tayong continuous, discrete, and categorical. Okay, we have different types of variables too. For instance, we have what is ito nga, for example, yung continuous variable. We have age as an example, no? Age can be represented in theory in a continuum. So, pwedeng meaning it can range from 0 to an infinite number. Theoretically, no? Kasi, ano bang eldest, ano pinakamataas na age in record for a human? So, I think that's 140, no? 130, something like that. So, when we say continuous variable, these values are in continuous variable are not restricted to full numbers. Can vary from one point to another. So, pwede na sabihin yung age natin is 1.5 years old. Diba? So, it's not restricted to a whole number. Okay. So, in contrast naman, si discrete variable is one who has a finite number. What do you mean by finite? So, in between 2 points, the value is limited, representing discrete quantities. No? For example, if tatanungin ko kayo, meron ba kayong mga kapatid, you'll answer, meron akong isa, dalawa, tatlo, or apat na kapatid. No? There's no such thing as 1.5 brothers uh, unless merong kalahati lang, di ba? May kalahati ka lang ba? Yung lower part lang ba ang available sa kapatid mo, di ba? So there is no such thing as 1.5. So it can only be answered in a whole number. So that is your discrete variable. Okay, how about categorical? These variables are that who have a small range of values, no? And does not inherently represent a quantity. So for example, meron tayong your blood type. So hindi naman siya numbers, di ba? So it's either A, O, B, or AB, di ba? Okay, so we also have, for example, your gender, male, female, LGBTQ, di ba? These have small range of values that do not represent a quantity. Okay. Okay, so going back, research is commonly done to study a cause or an effect of an intervention. No? This is how a phenomenon is being studied and explained. So when we say independent variable, this is your presumed cause. No? Does a preoperative pain management have an effect in patients in post-op? So your probable cause is your preoperative pain management. While your dependent variable naman is your presumed effect. Kung ano yung magiging effect nun, sa tingin nyo magiging effect ng study, that is your independent variable. Okay, so the difference, independent and dependent variables, no? So when we say independent variable, that is your presumed cause. And then your dependent variable is your presumed effect, no? So, yun. So that is the difference of these terms, no? So let's go to, okay. So, okay. In research data, you first determine the concept or what problem or what problems you like to investigate and come up with a solution. And then collect relevant data. So let's say for quantitative research, data is expressed quantitatively or in numbers, no? Numeric form. So, for example, if you want to know how stressed an average nursing student is in a week, you will ask you can ask your subjects like this. So, in the past week, how stressed were you in a scale of 1 to 10? With 10 being the most stressed. So, you gather the answers based on your numerical measurement and collate them. That is your quantitative data. Okay, so for qualitative research naman, no, in its nature, not having numerical representations or hindi in numbers yung ano mo, yung data mo, you research data hinges on narratives, no? Or yung experiences nung subjects mo. Or in this case, yung nursing student. So, your results will be leaning towards kung ano yung experiences niya in the past week, which made him stressed, made him or her stressed, no? So that is in terms of qualitative research. So these are worded answers collected from the research participants. Okay. Now let's go to the challenges in conducting research. So we have five major challenges in conducting a research. When we say conceptual, we ask ourselves, how should the key concepts be defined? Paano nga ba? What will we include in the study? Ano-ano yung kailangan natin dito sa study na to? And what covers the study, no? We need to be specific in our setting our goals for a particular study so that we want, in order for our goal, our study to be specific doon kung ano yung gusto nating makuha out of the study. No? Next, we have financial. So, anong problema dito? We do not have, do we have enough resources to conduct the research? Paano natin babayaran to? Kasi, syempre, you will be using pen and paper, uh, considering the size of your study. Sabihin natin, 100 subjects. So, you'll be duplicating or replicating the resources to 100 participants. So, you will be facing a problem in terms of financial, no? So, when we say administrative naman, this covers the area of handling the research study. Can you, for example, can you manage the flow of the study? Mababantayan mo ba step by step yung study? Or kailangan mo ng additional na tao to observe with you? Will there be enough time to complete the study? Ano yung time frame mo? Can you finish it in 3 months, in 4 months, in 5 months? These are some of the problems encountered in research. Okay. When we say practicality naman, we need to consider the participating group. Can we fill the number of participants up to the point yung study natin has a relevant result? Let's say yung 100 na tao, 100 na research subjects, is it enough to provide to produce uh, the result that we are anticipating? No? Can 100 can 100 subjects be enough to fill yung degree of reliability ng study? Okay, so yan yung isang question din na kailangan yung sagutin. Okay. And the last thing is we need to consider is yung ethical reasons. We must consider also human rights infringement, no? Last time we already discussed yung mga types of ethical or mga ethical concepts that needs when it comes to research. So, in order not to violate this and render the research unethical, we also consider the ethical side, no, of the research. So, if for example we do drug testing to humans without proper safety details, so pwede ba natin gawin? Siyempre, hindi. It is unethical. Or do we kailan po natin mag-ask ng documentation, our permission to document participating individuals? Yes, so we need to secure um, consent, no? These are put carefully into consideration when doing research. Okay, so basically we are trying to conduct research to find the truth, no? Research cannot contribute evidence to guide clinical practice if the findings are inaccurate, biased, or fail adequately to represent the experience nung target group na tinetest mo. So, if based on a misinterpretation of a data, nagkamali ka sa pag-layout ng research mo, it will lead to inaccurate or failure in your research part, no? So hindi na siya magiging valid. So consumers of research needs to assess kayo. Syempre, you need to assess the quality of evidence offered in a study by evaluating the conceptual or methodological decisions ng mga researchers, no? So you have to check step by step kung tama ba yung ginawa nyo, kung if the work the flow of the scientific method done in your research are all valid, no? So yun, we have to strive hard to make good decisions to produce the best evidence of the highest possible quality. Okay. For example, in quantitative research, we use several criteria to assess the quality of the studies. And two of the most important criteria are reliability and validity. So what does reliability mean? So when we say reliability, it refers to the accuracy and consistency of information obtained in a study. No? So the term is most often associated with the methods used to measure research variable. For example, if yung thermometer nyo na ginagamit is measuring, let's say, 98 Fahrenheit or 36 centigrade. Okay, 1 minute. Pag measure nyo ngayon, 36 degrees Celsius. And then after another minute, naging 38 siya. So the reliability of the thermometer would be highly suspect kasi there is a huge gap on that 1 minute interval of reading. So hindi siya reliable. Okay, this is important in interpreting statistical analysis. Bakit? Because the results are reliable when the probability of doing the testing in a different set of subjects, meaning, for example, pag ginawa mo tong research ulit sa ibang group, yung probability of having the same answers would be close to 100%, no? It can or it may reflect the same data or result or as close to the result as possible. So kahit paulit-ulit mo paggawin yan, parehas lang yung magiging result. Kahit iba pa ang gumawa niyan, parehas pa rin yung magiging result. That is what means when we say reliability. Okay. I'll show you something. Sorry. Yeah. So reliability versus validity. So we have here, in an experiment, you need to pay attention to many things, and arguably two of the most important ones, ito na, si reliability and validity. Your experiment needs to be both reliable and valid in order for it to make sense and provide you with quality results. So this one, where I told you about reliability, is the extent to which the outcomes are consistent. So the key term here is consistent when it is repeated more than once. Okay. While validity is the extent to which the instruments that are used in the experiment measure exactly what you want them to measure. For example, yung thermometer dapat hindi siya defective. So if talagang gusto mo i-measure yung temperature ng subjects mo, dapat the validity of yung research mo should really use a good thermometer kasi that is what your research is focused on, no? Okay. So paano naman pag qualitative research? So meron tayong tinatawag na trustworthiness or dependability, no? Kasi kanina sabi natin sa quantitative, we need reliability and validity. This is very applicable to those yung using numerical data. So how about naman for descriptive or narrative type of research like qualitative research? Okay, so dependability refers to the evidence that is consistent and stable, while Yung trustworthiness naman, yung shows a degree of confidence in the truth. Pag sinabi natin, pag sinabi natin uh, uh, post post-operative patient experiences pain. So, do you agree or not? So, meaning it is common across those patients who are going or who have undergone surgery to experience pain. So, that is consistent, no? So, yun yung example ng trustworthiness, no? Okay, so since qualitative research are based on experience, the data is being interpreted by the researcher. So, hindi pwede sabihin ni researcher na some of the patient does not experience post-operative pain. No? Pwede niya siguro sabihin na some patients have uh, a little tolerance to post-operative pain, pero it's impossible for patients under normal circumstances to not experience pain after surgery. So, yung pag-analyze dapat ng researcher should have a degree of confidence in the truth, no? So, dapat tama yung pag-interpret nung or pag-analyze nung subjective data or yung sinabi ng patient. For example, I'm experiencing pain right now. So, dapat, kung ano sinabi nung subject, yun din ang i-transcribe ng researcher. Okay. Next. We understand now the different factors that, meron tayong tinatawag na research bias. No? Kailangan, we need to understand the different factors that leads to biases in research. So, ano ba yung bias? This is an influence no, that produces a distortion in the study results. Okay. So, ano to? So, we have diba? Okay. For example, because sometimes subjects tend to change their behavior. For example, sasabihin natin, in a questionnaire, um, sabihin natin, what kind of, uh, do you wake up in the morning early? O, pwede sabihin ng subject mo, yes, kahit hindi naman, di ba? So they tend to change their behavior, no? In order to present themselves in the best possible light. Siyempre, paminsan yung subjects mo, yung mga research subjects mo, nahihiya na ipakita yung tunay na sarili nila. Kasi baka mapag-chismisan, ganyan, or something. Although kahit meron na kayong agreement na it will stay confidential, there is that human nature to present yourself in the best possible light ever. Diba? For example, di ba, yung sa mga manliligaw, sa mga manliligaw, siyempre hindi mo na ipapakita yung bad qualities mo. You always put your best foot forward, di ba? So that is similar in research. So, hindi nila sometimes, siguro, out of reflex or out of human nature itself, nila, they tend to change their behavior in order for us to read them as positive individuals. Okay? So that is one type of research bias. No? So different categories are presented in which subjects are choose from. No? In order to show their idea of image of themselves. So that is your another one type of bias. Okay. There is also bias when the research distorts information. That is a very taboo in research. No? Eh, um, for example, gusto ng researcher na ito yung magiging result. Let's say, sabihin na rin yung temperature, dapat nandito lang siya sa 36.5 to 37 degrees Celsius. So, result. So, yung actual result does not fall under there. So, the researcher tend to, in order to prove his theory, in order to get his desired result, medyo iti-tweak niya yung information na yun. So, we call that subjectivity of the researcher. No? So, that is one bias also. Okay. Sample characteristics. This, okay. How do you say it? This, when we say sample characteristics, no, um, the sample itself, no, it may be biased. For example, sabihin natin the researcher is trying to research on opinions or new attitudes when it comes to abortion. Pero yung subjects niya, puro anti-abortionist lang ang in-include niya sa study. So, yung sample itself is biased. Kasi ang automatic, ang answer ng attitude nila or answer nila is negative towards the research, which is yung abortion. No? So, hindi ka magkakaroon ng accurate result. Yan. Okay. What is research control? So when we say research control, this is one type of eliminating bias. No? Holding a constant in other influences on the dependent variable. So since biases cannot be totally avoided because it is occurring or spread out through a wide area of group of people. So one thing that we can do is we can do a research control, no? It involves holding a constant of other influences on the dependent variable. So that yung true relationship between independent variables can be understood um, without the interference of other uh, we categorize them as extraneous variables, so yung factors that can ruin your um, in the interpretation between your cause and effect, no? In other words, this research control attempts to eliminate contaminating factors that might cloud yung cause and effect relationship. Okay. So, we also have randomization. No, ito yung kanina sabi ko, I'll be discussing this. In randomized studies, subjects are selected randomly by chance. So, hindi, for example, babae lang dito, hindi ganun. When we say random, pwedeng babae, pwedeng lalaki, pwedeng other age group. As long as nandun siya sa criteria na nilagay mo. Sabi yun, age 16 to 20. So, group A, hindi pwede age 16 lang. And group B, age 20 lang. Ganyan. So, you mix and match according to by chance, no? Ang pagpili mo. That is randomization. So, this means that every subject has an equal probability of being selected. No? So, this is one way of controlling extraneous variable. It's very common in quantitative studies. Okay. So there is also what we call generalizability, no? When we say generalize, so pag sinasabi natin generalize, it is the extent which findings can be applied to other groups and settings. For example, sabi natin age group of 16 to 20 here in Zamboanga, and then someone would want to try your research in another area. So if he does that research to those criteria that you have nominated, like age, gender, and as long as nandun siya within that range nung dineclare mo dun sa research, they can do the research again with showing the same results as well. So it is general, no? Pare-parehas uh, across different, it can be applied in different settings. So that is generalizability. It is also under the concept of randomization. Okay, so for example, um, this is an example research. No? a study whether teenage women are at higher risk of having low birth weight infants than are older mothers because of their age. So, dito I already defined kung ano yung independent and dependent variables, no? We have low birth weight as your dependent variable because we are trying to find out if there is a significant effect because of the age of the mother, we have a significant effect, which is the low birth weight infants. Okay, we want to know. In this situation, we want to test if there is something about the women's age development that causes difference in the birth weight. Okay. So the question is whether maternal age itself causes difference in birth weight, no? So, pero however, meron tayong mga extraneous variables, no? That present could affect birth weight. For example, yung nutrition, yung mother, or yung prenatal care, nagpe-prenatal care ba sa mother. Kasi these factors or these variables can also lead to low birth weight. So these are other factors that can affect your dependent variable. So just to have an accurate conclusion, which really points out that age has a significant effect on the birth rate, in order to have that conclusion or the direct cause and effect relationship between the age of the mothers, we must put the extraneous variables constant across all subjects. So dapat, for example, we have to put the category there that this group are properly nourished and have regular prenatal checkup. So we already eliminated the possibility of uh, yung variables na yun to affect the low birth weight. So thereby eliminating them. No? So that is one type of sorry, okay. So okay, that's how you minimize the errors in your research. Okay. So, yeah. Nursing research mainly utilizes quantitative and qualitative type of research. So, when we say quantitative, sabi ko kanina the lecture, federation, it can be classified further into experimental and non-experimental, which uses variables to test their relationship, cause and effect relationship. So this time when it is also the same, no, when intervention is used in nursing practice. So when we apply an intervention, we are trying to find out if that will have a direct effect on the or on the person that we did the intervention to. Okay. So how non-experimental research naman allows nurses to collect data without doing an intervention. So it's important when we are doing observations or coming up with on how to explain something in the nursing practice or a phenomena that's happening or how to avoid it. So yun naman yung non-experimental. Okay. So for example, in this example, the researcher intervened by designating that some women would receive the some maximal exercise protocol and others would not. So what do we mean do we mean when we say some maximal exercise? So meaning this is a type of exercises to determine yung aerobic capacity of a muscle, no? So usually it is done through a treadmill, yung bike. So yun. So we are um, we are trying to control the independent variable here, which in this case was the type of protocol. So by doing a submaximal exercise protocol, we are trying to see its effect in the muscle muscle contraction strength among women with stress urinary continence. So yun. Okay. Another example, this is a non-experimental study. No? The factors that contribute to hospital readmission in Hong Kong. So, di naman natin makokontrol kung sino yung ma-re-admit or hindi, no? So, the researcher did not intervene in any way kasi there is no way of finding out kung sino yung possible na ma-re-admit. But, they observed and measured kung anong meron yung subjects na, kung anong meron yung mga patients na yon, kung bakit sila na re-admit. And they compare it with those na-discharge pero hindi na re-admit. Okay. So they explored whether there were identifiable characteristics, no? Baka pwedeng kung saan sila nakatira, yung age group nila, or yung gender, is that a contributing factor kung bakit sila na-readmit? So that is an example of your non-experimental study. Okay, so yun. Okay, going back sa qualitative research naman. Okay, when we say qualitative research, nursing research, it focuses on understanding key social, key social structure, no, or psychological processes that occurs in a given setting. So for example, when we say social experiences, sabi natin, death experiences, for example, these are not quantifiable, no? Hindi natin pwede measure in numbers yan. But, di ba? Pwede mo ba sabihin na, can you tell me in a scale of 1 to 10, how sad are you that your mother died? Di ba? Hindi. That would be rude. No? Hindi mo pwede tanongin yan. In a scale of 1 to 10, how sad are you? Pero, you can ask, as a nurse, you can ask them na, I understand what you're going through. I may or may not understand what you're going through, but it would really help if you would share your experience, no, to me, so that we can find it. So we can find means of comfort to deal with your grief. No? So for example, yeah, that's how qualitative research works. So you're trying to collect the experiences of your subjects. So for example, this study, a study to explain the maternal processes of managing late stages of breastfeeding, meaning yung mga nagbe-breastfeeding doon sa 2 and up, no? There are mothers who still breastfeed at the age of 4, no? And then what are their experiences when trying to remove the child trying to wean the child from her breast, no? So, so this focuses mainly on the experiences or yung mga nangyari dun sa mother who breastfed dun sa mga late stages na. Kasi usually hanggang 2 years old, no? So, what happens while ano nangyari sa kanila habang tinatanggal nila yung pag-breastfeed dun sa bata. So, this is an example of your qualitative, no, research because you focus on experiences. Okay, ito naman. Example, an ethnographic analysis of nursing home residents focusing on ethical issues of daily living affecting nursing home residents with dementia. So, dito naman in this study, they are trying to find out the cultural background, practices, beliefs of those patients in a nursing home that have dementia. So, trying to compare lang. So, hindi mo naman pwede sabihin na dahil hindi mo pwede quantify yung cultural background, no? You have to interview them kung ano yung kung ano yung experiences or day-to-day practices nila which can contribute to or which can affect yung daily living nila, no? So, yun. Again, experiences, non-quantifiable. That is your qualitative research. Okay? Okay, so paano naman? Let's go to how we do quantitative research. No? In research, we usually start with a problem in mind. So, dapat may problem. Ano yung problema when it comes to nursing practice? No? And then we derive a solution to that problem. Pero, systematically speaking, how do we do research? Now, sige, let's focus on quantitative studies first. Okay, so ito, let me show you. First, we will try to understand the concept of listening. Yeah. So activating these activities include reading, conceptualizing, theorizing, conceptualizing, no? So iniisip mo kung ano yung mga problema na gusto mo i-cover dun sa research mo. You try to theorize kung ano magiging effect ng research mo. And then going back, you try to rethink again a specific question by you're trying to address. And then you're reviewing ideas naman, you and your colleagues. So mag-ask ka ng opinions kung this problem ba is already solved, meron na bang solution to this problem, or kailangan pa ba ito, masyado pa bang itong broad na concept, kailangan pa ba natin i-drill down specifically, no? So, yun. So, it mainly uses your deductive reasoning, insight, and creativity in your topic of interest. So, what are the steps? No? First, we have formulating the problem. No? We have to come up with the problem first. State the problem, no, that you want to address in your research. Then you review the related literature. No, it's always there. The reviewing of related literature. So you have to do research. You you have to do a background study on what the problem is all about. No, and then you come up with a theoretical framework. No, kung paano mo gagawin yung research mo, step by from the research type to the research design, that's your theoretical framework. So gagawin mo siya step by step, no? And then you have to formulate your hypothesis, no? Ano yung educated na guess mo? So you will try to guess what the resulting effect will be in your research. For example, if you do something like this, it will produce this effect. So that is formulating hypothesis. And you do your research to prove that hypothesis. No? So selecting a research design, it's either you do an experimental, quasi-experimental, and non-experimental research. So that is selecting a research design. So which best fits doon sa problem mo? Paano ba natin i-measure to? Paano ba natin to mapapasagot yung mga subjects natin? So that's what happens in the conceptual phase. Okay. So when we say we are trying to formulate the problem, no, because this is one of the first things that the researcher must do, no, is to develop a research problem or a research question. No? Good research depends um, on a good question. No? Without a significant interesting problem, the most carefully and skillfully designed research problem is of little value. So ibig sabihin, if hindi interesting yung problem mo, for gusto mo lang malaman kung bakit uh, ano yung mga leading causes ng chismis sa ward or sa area. So, hindi yan very significant in the practice, no? What we are talking about here are significant research problems, no? So, for example, how do we address or how can we address infection during post or in patients who have undergone operative surgery. So that is an interesting problem because it is very common to have an infected wound site. So What can we do to prevent that? No? So that is one example of an interesting problem in nursing field, no, in the clinical practice, no. So what else? The research question needs to be specific, needs to be measurable. Kasi sabi natin, quantitative research, kailangan it is expressed in numbers. So whatever the question will be, dapat yung ano niya, yung results niya can be measured. So, yun. Is it important enough? Is it an existing problem that remains unsolved? So, wala pa bang solution to? Hindi pa ba ito nagawa ng research ng iba? You have to consider that, no, when asking that, when you're deriving your question. Okay. So, another thing to consider is yung ethical concern. So, if if I go on to this research, will it not violate human rights? No? Will it be for my patients? Will it be pro-patients or patient-centered ba to yung approach nito na research na to? So that's one thing you need to consider when you are trying to state your question. Okay, let's go. Okay, okay, sige. Okay. For now, we will be concentrating muna in doing a research problem, no? So, this is my assignment to you, to every one of you. So each one of you will be coming up with a research question. So anything that is interesting in the clinical practice that needs to be addressed or answered, no? We will be doing quantitative research, no? So we will try to formulate each of your research step by step. So by starting with the research problem, I want you to formulate your own. So I want you to find a research problem that is being faced in the nursing practice right now. Okay? So yun lang. So after we identified your each individual research problem, we will move to the next step. Okay? So thank you and good day to you.